My name is Miranda Dodak, and this is a video submission of my occupation-based kit in Pico Project. My occupation-based kit is based on a client who is a female in her mid-40s who is diagnosed with lateral epicondylitis and who is referred to outpatient occupational therapy services. This client really enjoys sewing, especially quilts, and she just got into doing purses and bags, and she loves to show us pictures when she comes to therapy of all the things she's made. She's extremely talented. And she also really enjoys doing her hair and makeup, which is an area that she has not been able to do very well since her diagnosis and since her symptom exacerbation. She has a really hard time holding her hot tools and her blow dryer and stuff for a sustained amount of time. And she also has a really hard time with sewing. She's not been able to do any kind of sewing since this symptom exacerbation began. And these are two areas that are very valuable to her. And these are her two main areas of goals. So her main functional deficits include elbow extension, wrist extension, grip, and prehension strength, all of which are limiting those tasks with grooming and those tasks with leisure. This activity begins with the client standing in the board at about waist height, and the client should be standing far enough away from the board to facilitate that elbow extension. And this will begin with the client cutting a piece of thread about the width of the board and then beginning to weave the thread through the eyelets. You could have them do this vertically. They could also do this horizontally or in a zigzag pattern, but they should be attempting to do it unilaterally with their affected extremity. But this can be graded if this task is too difficult for them. And then you have them do the entire length of the board to the best of their ability, so they can facilitate that really good elbow extension along with that fine motor prehension. Originally, when implementing this kit in the clinic with the client, I had the board up vertically and at about shoulder height. Through the activity, we found that using it tabletop was just as effective for this client because she didn't really have any shoulder deficits. So that added shoulder flexion wasn't exactly beneficial to her, but it was nice to note that in the future, if you had a client who needed that facilitation of shoulder flexion, it was possible with this board. But for this client, we thought it would be best to just keep it tabletop because she was getting all of the input she needed that way. And another thing that I found out through the implementation process was that the thickness of the thread actually does not correlate with the difficulty level as I thought it would. So it would be assumed that the thinnest thread would be the most difficult, but the client actually found it the most difficult with this ribbon, because to get it through the smallest eyelet, she not only had to get it through, she actually had to fold it. And so that extra prehension was very difficult for her, which was something that I didn't foresee happening. And overall, her feedback was really great from doing this kit. She's definitely said that her arm got quite a workout, and it was something she was really passionate about. So she wanted to try all the different thicknesses of the threads. She wanted to do it all. I had the idea for this kit when starting the Pico project, and I decided to ask the clinical question, among patients with lateral epicondylitis, do fine motor coordination and range of motion activities help increase upper extremity functioning? And through my literature review, I found very strong evidence for the use of exercise within treatment. And exercise as a broad category does include range of motion and grip strength. Range of motion is greatly seen in this task, especially because the client has difficulties with elbow extension and wrist extension, which are both worked on through this activity. I didn't find as much evidence for prehension, but I did find in our textbook that the muscles used for prehension and grip are the wrist extensors to stabilize that movement. So thus, working on prehension will help strengthen those wrist extensors due to their role in stabilization during pinch. So it wasn't as thoroughly investigated, but it was still evidence-based, which was amazing because then I got to go ahead and make this kit that was not only evidence-based, but meaningful to the client. This kit would fall under the category of a skilled OT service because not only is it an occupation-based and meaningful activity, it's also evidence-based. So this is an activity that we as OTs understand the functional rewards and the functional gains being achieved through working on something like this. This isn't just for fun or just for exercise. It's a balance of both, which as OTs, that is why we do what we do. We need to make sure that what we're doing is actually going to prove clinical benefits, but also be fun and engaging and meaningful to the client.